All right. Hey guys. So my name is Josh, and I'm a member of the Indiana State Doctorate in Athletic Training program. This series of videos is going to be done between myself and Chrissy Reichart. She's going to introduce herself when her video comes up here. This is going to be my patient, Taylor Smith. The first technique that we're going to be showing you guys is an active release technique for the subscapularis muscle. Now, the reason that you would do this type of technique is if you have general tightness of the shoulder and you want to kind of hit and find all kind of trigger points or adhesions or anything like that. But it's also a tight or overworked muscle in today's population just because everybody sits in internal rotation. Everybody's got the forward shoulder, forward head kind of posture, and it just allows that muscle to just kind of get tight, and it's always working. So to start this off, you're going to have your patient lay down. Now the subscapularis muscle, you got to kind of work around inside of the armpit to try and identify where the actual muscle is, because you've got a bunch of muscles that are kind of running up throughout this area. You have the lat, which is pretty prevalent. You have the pectoralis muscles, and then deep right up against in the pocket or in the fossa of that subscap is where you're going to find the subscapularis muscle. So the way to identify it is you can go ahead, kind of put your thumb in there and try and move around. Make sure you're asking your patient as you're digging around inside their armpit if they have any weird tingling or neurological symptoms, because if you are pressing on that brachial plexus, you're going to get some uncomfortable symptoms there. So you're going to go ahead, dig around with your thumb, have them go into pull into internal rotation against your hand. That'll activate the muscle. Boom, you find it. So we're going to sit there. You're going to kind of move around along that muscle and try and find any adhesions or trigger points. She's got one definitely prevalent, forward shoulder posture. I'm not trying to make fun of you, but yeah, you're pretty tight in there. So what I'm going to do is once I've identified this trigger point or this adhesion, I'm going to put my thumb deep inside of it. I'm starting off with her in a slack position, so we're in internal rotation. We're a little bit more in adduction. And then once I find it, the active release technique is going to be me putting her into external rotation, and then we're going into abduction. And you want to try and not let your thumb kind of slip around or slide. You want to keep it right on that same spot, and then back into internal rotation and adduction, and work your way back out. So we're going to do 6 to 8 of these motions here, or until you can kind of feel that adhesion or that trigger point release, and at that point you can kind of move on, try and find another one, or move on to a different muscle. If you're finding that they have that internal rotation tightness, you have those other internal rotators that you can look to hit. For her, I would move right into her latissimus dorsi. All right, and that's the active release technique for the subscapularis muscle. Thank you.
Hi, my name is Chrissy Reichert. I'm a student at Indiana State University in the Doctorate in Athletic Training program. Today, I'm going to be showing you how to do a positional release, for the levator scapula muscle. So you're going to have your patient seated. You can also have them supine, but you want to make sure that the elbow's on a bolster so that let me move that up a little bit, so that the shoulder is elevated, because the levator scapula is going to do the elevation. It's going to do neck extension, cervical neck flex extension. It's going to do same side rotation. So you want to have them in the most shortened position as possible. So we're going to have that shoulder up on a bolster. Let's reassess that.
There we go.
They're fine, no worries. So then his shoulder's up. We're going to have him in slight extension, and then we're going to rotate him towards the side that you're treating. You're going to be palpating the levator scapulae. It's going to start in the cervical spine, and it's going to end right here at the medial border of the scapula. So finding the trigger point here, have him relax. We're going to put him in that shortened position. There, he's got one right there, right very close to the medial border. You're going to apply pressure in that shortened position. You're going to hold it for about 60 to 90 seconds or until that adhesion releases. You can do this for about 3 sets. You would do this when it's overacting, when they have poor posture, when you're trying to get them to relax a little bit more, or if they have such as you're trying to work on scapulothoracic rhythm because they don't have the shoulder depression, so their lower traps are not activating. And then if you feel that release, you can come up further inside the muscle and even come up here into the cervical spine. Everyone seems to have a lot of adhesions here. And you can even put them in a more shortened position and get a little bit more release there. Now that we've discussed a positional release that can be done by the clinician for the levator scapula, we're now going to be doing a self-release. So this technique can either be a pin and trap method, or it can be a trigger point release, it could be clearing technique, whichever really benefits you as the patient on your own. It's a little difficult to do on yourself because it can be a little uncomfortable, but it's really going to provide good relief. Again, it can be used for when your levator scapula is overworking, it's tight, you've got trigger points. A lot of times it can happen from studying or from doing a lot of looking around and not getting a ton of stretch in there, and even because you have poor scapular rhythm or scapular strength. So again, what we're going to be doing is we're going to be sitting here in the chair. Instead of putting it in a shortened position, this time what we're going to be doing is lengthening the muscle. So we're going to depress our shoulder. You can do that by just hanging your arm down next to the chair, or you can actively depress it more. The next thing you're going to be doing is rotating away from the shoulder that you're going to be, or the side that you're going to be releasing, and you're going to flex forward. This is really going to put a stretch on the levator scapulae here in the back of the neck muscle. I immediately feel a stretch in there, so it's not going to take a lot for me to do a pin and trap or a clearing, whatever you prefer. So for this, I'm going to show you a pin and trap just because I find that to be the most helpful for myself, and you can try a variety of techniques. So I'm going to bring myself into that flexion and that rotation away. I'm going to find an adhesion, which is really easy. I've already found one right here. What I'm going to be doing is holding it and going further into a stretch, maybe coming up into a relaxed position and then a little bit further down into it. That's really going to cause that stretch there. It's so much more effective. Or what you can do is you can even just take your own fingers and massage around in that stretched position to find a trigger point. And for there, you can do a barrier release where you're holding from 60 to 90 seconds or until you feel that barrier release. It's really effective. It's something you can do at home. A lot of people often use tennis balls or some kind of object, but personally, I just find that using my opposite hand is really just as effective.